Welcome back to Let's Talk About It with Kelly. This is my husband, John.
Hello.
He is the trichologist at our clinic, Freedom Clinic, Toronto. And I'm Kelly. Welcome back to Season 2 of Let's Talk About It with Kelly. Our first topic is going to be trichotillomania. This is a serious and very interesting topic. So, John, the first question that I have for you, for listeners who have never heard of trichotillomania, how would you explain it in simple terms?
Okay, so trichotillomania is a compulsive desire or need, sometimes it's even unconscious, but a compulsive act of pulling your own hair out or breaking it off. Mm-hmm. So pulling on your hair, usually a nervous kind of thing. Yeah, that's what it is. It's pulling on your hair. And it breaks it off or it pulls it, or some people like the feeling of it. So that's what it is.
So in simple terms, it's pulling of the hair.
Yeah, compulsive need to pull your own hair, or a compulsive act of pulling your own hair.
A compulsive act, because I know some people that don't even realize that they're doing it.
Well, if you're just twirling your hair, that's
like a nervous.
Yeah, that's a similar thing. It's a nervous thing, but it's not as destructive, of course, if you're sitting there yanking your hair out, pulling your hair and breaking it off. So that's really destructive to your hair. So yeah, it's well, we'll talk more about it, but that's basically what it is. This need to pull or break your hair off.
Okay, great. Without identifying anyone, can you share a patient's story that really changed on how you view trichotillomania?
Okay, so trichotillomania, we think of it as sort of a psychological thing, because it is a compulsive disorder, if you will. So when we think of those things, we usually think, okay, so because it's psychological, well, we need therapy to fix it. So as a trichologist, we're not therapists, but we do act as therapists a lot of times. But what I learned from consulting and then, learning more about trichotillomania and then working with specific patients is patients came in. So I had a couple patients, so two different stories here.
So two stories.
Two stories. The first story is patient came in and was pulling their hair and had pulled out the whole center part area of their hair. Okay, so they're just pulling. Yeah. Nervous reaction. The patient knew they were doing it, okay, but didn't really have a solution to stop. She couldn't stop. She was in therapy. She tried certain medications. So she came to me saying, I want to do SMP in there because I can see this big wide line. If we do SMP, then people won't see it as much. And I said, okay, that's a good idea. So I filled it in, and lo and behold, because the treatment was done there, she stopped pulling there.
Because of the SMP?
Well, yeah, because something had been done to her scalp. She didn't want to touch the SMP. She knew that was hiding it, so she didn't. So somehow, psychologically, it stopped her from pulling her hair out. Very interesting case. Wow. And that happened in another case, too, after that. And then the second story is a person came in and was pulling their hair out and said, I want to get a hair system to cover my scalp so I won't pull at it. And lo and behold, we put the hair system on, and this was a very serious case. The whole top of the head was cleared out of hair from pulling.
Wow.
And we did a bonding type of hair system, and lo and behold, all the hair grew back. And
underneath the hair system?
Underneath the hair system, because we did it in a way that you didn't need to cut the hair. So there's ways of attaching hair systems where you don't need to cut the hair. You can let it grow. So we did it that way, and then after quite a few months, the hair was growing back, and the person wasn't touching it anymore. So then we took the hair system off, and the person did have a relapse, so we put the hair system back on.
Okay.
And since we've removed it the second time, we haven't seen the person back again, so we assume that it's,
that this person's not pulling.
Maybe this person's cured now. So what these taught me is that aside from psychology, there's other ways we can manipulate the situation to maybe get people to stop pulling. It's kind of like putting that, people who bite their nails obsessively, you put that stuff that tastes really bad on it, and then it stops you from doing it, right? Right. So it's kind of like that sort of thing. So it's a way of distracting you or stopping you from pulling it. So those two options, they're cosmetic options, but they can sometimes help certain people.
Two success stories.
Yeah.
Wow, very interesting. Okay, John, how much shame or secrecy do people with trichotillomania typically carry?
Well, again, not being a psychologist or therapist, I'm sure a lot of them are carrying shame, but they don't really talk to me too much about that. Secrecy, most people are very secret about it. They hide it. They try and hide it. They're embarrassed about it. Well, I guess that's shame. But a lot of people are very open with it and do share it. So, and that's really important. I think the more open you are about it, the more you talk about it to people, then the more you can sort of probably get better help and get control of the situation. If you're hiding it or in denial about it, then it's going to be much harder to fix this kind of problem. But it's a very tough problem to fix.
Right. Wow. Okay. Do you find that trichotillomania often coexists with other conditions like anxiety, ADHD, OCD, depression? Do you find that some patients?
Well, that's what the studies show, is that
the studies.
The comorbidities are all are to do mostly with other psychological disorders, OCD especially, ADHD, but almost any type of mood disorder is certainly associated with it. And sometimes therapists will try using medications for depression or anxiety, like the SSRIs, SNRIs, to treat it. The other ways of treating it are through therapy, of course, but there are some medications that have been helpful in doing that.
So helping with the OCD and depression, those medications might
sometimes
help them from pulling. Okay.
Yeah, there's some evidence that it
Some
works.
evidence.
Yeah.
Okay, thanks, John. So next question, why do people pull their hair?
So why do they do it?
Yes.
We mentioned it's an obsessive compulsive disorder, usually. They usually are doing it, well, a lot of people do it as just a way of coping with nerves, I guess. They don't even realize, a lot of people don't even realize
so
they're
it's
doing
their
it.
nervous system.
So it's a nervous compulsive disorder. Why would they do that? It's hard to answer those questions. Some people love the feeling of it. So we'll talk to people about it, and they'll say they'll just like the way it feels when their hair is being pulled out. Okay, so
is it kind of like satisfying a scratch?
Maybe. Obviously, it's much more intensive pain.
Yeah.
You would think it would really hurt because there's so many nerves in every little hair follicle, and when you pull your hair out, you really feel it.
Right.
So it's surprising that people can actually tolerate that.
It's an addiction.
So yeah, people who do it, it's very hard to fix and cure. And we get different types of people. We get people who know they do it, who aren't really embarrassed about it, that just know they do it. Or maybe they're a little bit embarrassed, but they know they do it. They talk to people about it.
Right.
But then we got people who come in and they're in complete denial. So they'll come in for a consultation on hair loss, right?
So
and they'll have this patch of hair loss,
Right.
okay? And it's usually not a clean scalp. It's usually stubble, because usually it breaks. It's not always pulling right out by the roots. That does happen sometimes, but usually it's broken off. Okay? So when we put that under the microscope, we can see all the broken hair. Okay? Now, when these patients often go into people who aren't experienced in trichotillomania, it can get misdiagnosed as alopecia areata because of all the short hair. Maybe they think
And
it's
the
starting to
patches,
grow
maybe.
back because it looks like a little patch of hair loss. And sometimes they grow to be very big.
Wow.
Okay? And then, or it can get misdiagnosed as a fungal infection, because fungal infections often break the hair down off really close to the skin.
Right.
So it's really important to have this diagnosed microscopically, so then the patient comes in and you do your exam, and they're not aware, or they're in denial that they're pulling or breaking their hair. This is where it gets really intensely psychological, and we end up getting into much more complicated psychological issues with hair loss.
Okay.
There's actually a whole nother episode on that.
you want to do another episode
On
on just psychological hair loss?
Psychological hair loss. That's something we need to talk about because trichotillomania is just one of a few different disorders associated with hair loss or that cause a certain type of hair loss.
Well, let's next episode we will continue on with psychological hair loss. I think that's a great idea. Moving on for a couple more questions. Is that okay, John?
Yeah.
Okay, that's great, John. What is the most effective treatment approach you've seen for helping patients reduce or stop pulling?
You know, because it's a psychological thing, the best way to approach it is with therapy. So, and studies seem to indicate that the best approach to curing this, you know, getting people to understand what they're doing and training their brain to not do it anymore is cognitive behavioral therapy.
Yeah.
So CBT, cognitive behavioral, it's a very popular type of therapy. It's used in a lot of different situations.
To change the way you think.
You think and the way you act. So cognitive behavioral means your brain is controlling your actions, right?
Okay.
So you've got to train your brain to control these actions. Okay, so that's what cognitive behavioral therapy tries to do. So that's been shown to be that can be
the most effective.
Yeah, I think the most effective. Again, there's some medications that can help. We do those physical things like the SMP and the hair system. So again, it's a very tough thing to stop and cure.
Yeah.
But the CBT seems to be the best, the most effective way of actually curing it.
Okay, that's great, John. Would they get that from their therapist or?
Yeah, you would have to, you know, and it's hard when you're consulting people, especially if they're in denial or if they're, you know, they
have to be ready.
They have to be ready, of course, you know, so
and commit to
some of them have, a lot of them, when they come to see me, they have therapists and they're trying to figure out ways of disguising it or stopping themselves from doing it. But they already have therapists. But if they don't have a therapist, this is what we try and get them into therapy about it. But it's really hard to do that with someone who's in denial.
Yes. Okay. Right? For sure. What are some small strategies listeners can try immediately if they're struggling from hair pulling? What can they try, John?
So you should start looking, you know, for a therapist right away. But one of the things that I recommend people do if they're aware of it and they don't mind talking about it is get your family involved or even your friends. So if you're at home and say it's a young person, a teenager, it's very common in teenagers. If you're at home and you tend to pull your hair when you're at home watching TV or maybe doing homework or, you know, whenever you're doing it, it's usually,
that you don't notice that you're doing it?
You don't notice you're doing it because it's so automatic. It's so compulsive. You know, if talk to the people around you. If you see me doing this,
right,
please tell me to stop.
Yeah.
At least make me aware of it.
Right. You know, that's really good.
Right.
I like that.
Yeah. So try and get people involved and talk as much about it as you can and you know, just to try and be aware of it, you know, and do look to getting therapy. Again, it's a tough thing. Certainly don't be ashamed of it, you know, like, and
everybody's got something.
And acknowledging it. So acknowledging it
right
is so important.
Right.
You know, maybe watch yourself do it in the mirror. So you see yourself doing it, you really imprint it on your brain that you're doing it.
Yeah. Yeah. That's a good one. Thanks, John. Okay, next question. Can hair grow back after years of pulling, and what factors determine recovery of the hair follicle? So
what determines whether or not it's going to grow back is if the follicle gets damaged, and that only happens if the hair actually gets pulled out. Mm-hmm. So I mentioned that in most cases the hair is not being pulled out, it's being broken. Mm-hmm. But in some cases it is being pulled out. And if you know, they pull out the hair and it's in the growth phase, that can really damage a follicle.
Right.
The first couple of times they do that in one spot, maybe the follicle survives and the hair regrows normally, or maybe it regrows a little miniaturized. Mm-hmm. But then if you keep doing it over and over, the chances of it being permanently damaged increases.
Wow.
Okay, so it's again, it's pretty rare for trichotillomania to cause permanent hair loss, because usually, like I said, they're breaking it. Often it migrates.
Most time they're breaking it off, not pulling.
That's right. And breaking it off generally won't hurt hurt the hair, and it's a really fast, short thing.
Right.
Whereas, this traction, what's called traction alopecia, that's prolonged pressure on a hair follicle,
Right.
causes damage to the follicle. With trichotillomania, it's not really prolonged. It's a short pull. And then if they migrate, if they break the hair and then they migrate, then the pressure is going to be off that hair for a while.
Right.
So that gives it time to regrow. But yeah, long-term pulling in the same area, pulling out about by the roots, that's what would cause the damage.
Okay, great. Okay, well, that's about it for trichotillomania, but I like your idea of having a full episode on psychological hair loss. So let's do that. Okay, John?
Yeah, we'll get some topics together and we'll look at that, because the
Yes.
thing with trichotillomania is it can be a simple trichotillomania where a person has a nervous reaction and they're just pulling, but sometimes it can be so severe
Yeah.
that it causes extreme hair loss. It can be very detrimental to a person's life, sense of well-being and lifestyle, and it leads into more serious types of psychological hair loss. So we'll explore those a little bit more.
Okay, great. Thank you so much, John.
Okay.
Okay, guys, we'll
welcome.
see you next time. Thank you. Bye.
Bye-bye.